Thank you and good afternoon. Today is our briefing for July 23rd, 2020. And of course, we have our briefings now every Monday and Thursday at 3 o'clock. And we'll be joined today by Kelly Colopy from the Long Beach Health Department. And as always, we will do a Spanish translation after any questions that the press or the community might have. And of course, we have Paola, who's with us, who will do our ASL translation. So thank you. Want to just start overall. We have 7,225 residents that have tested positive for COVID in Long Beach. We're now over 7,000 in the city. That is, since earlier in the week, an increase of 700 new cases just from Monday alone. We do know that about approximately 5,480 folks have recovered from COVID-19 in Long Beach. And we did, fortunately, not have any new related deaths as it relates to yesterday's number. So that's always a good sign, and we hope that continues. We've also been talking about the positivity rate. Kelly Colopy is going to kind of walk us through that, but our positivity rate is now down to 13.5 from the high of 15.2 that we were at, and even lower than where we reported before. It's still much higher than we would like. I want to also just mention back to the issue around deaths per population. You probably see the graph that's up. Long Beach continues to fall below the LA County rate when it comes to deaths per 100,000. And you can see us there in the light blue line. But of course, we do fall above the state level of deaths per 100,000. So this has been generally consistent throughout this COVID crisis. So we obviously monitor this very carefully. We want to remind everyone, though, that to keep us safe, we just got to continue to do what all the doctors recommend us to do, is to stay physically distant, to wear masks, and to please continue to wash our hands frequently. We also know that we are working hard to reduce deaths within our hospitals as well. Now, we know that since we first began this pandemic, we've lost 161 residents to COVID. 118 of those have been to long-term care facilities. But I also wanted to show you this new graph. This graph shows the median age of newly diagnosed COVID-19 cases, and the median age is now 33 in Long Beach. This was not the case earlier on. As we know, this was something that we saw in many more older individuals early on in this health crisis. But now the median age is 33, and young people are becoming infected now, are the highest portion of the population that are becoming infected. Many, of course, are asymptomatic, don't have symptoms, and they're passing it on to parents or grandparents or other young individuals who they then pass it on to parents or grandparents. Also, as noted last week, we've seen a shift in the age groups who are developing severe symptoms and being hospitalized. This is a graph that shows you some of that information as far as the age groups that are hospitalized. We continue to see younger adults hospitalized, not just older adults. And I know that early on, we saw a lot of seniors, folks that were in their 70s and 80s, 60s. And what you're seeing now is many more individuals who are trending in their 30s and 40s and 50s at a higher rate than we saw before. So we got to continue, please, to stay safe and keep each other safe. Want to also share, we've made a couple announcements and are making them today. The first is on testing. The city put out a health order today to ensure that every single clinic and healthcare facility in the city is participating in testing for COVID-19. This is a move that is with the support of being encouraged by the state of California for all counties and all jurisdictions to do this. LA County shifted to this model a few days ago, and we are doing the same. So effective July 31st, which we know is coming up, all healthcare facilities in Long Beach need to be providing testing to all symptomatic individuals, as well as asymptomatic individuals who may have been exposed or meet the criteria. This will ensure that all of our small network of clinics, hospitals, and healthcare facilities in the city are also participating in testing on site or a referral. And so that we're creating connections between these healthcare facilities and private labs. This expansion of testing is essential. We know that the city itself is doing 1,400 tests, free public tests every day. But we also need to have the private sector and the healthcare sector also expand testing within their facilities. It's really critical as we look at the long-term fight around COVID-19 and how we better diagnose people early on and get them the care that they need. We know that some clinics and other facilities might be wondering, well, we're small. How do we plug in and start doing the tests? Our health department is already fielding questions and working with clinics. So if you have any questions on how your clinic or healthcare facility would be involved in this program, please contact the health department. And of course, if you need to get tested, we encourage you to do so. Make an appointment. We open up about 1,200 appointments a day, and then the rest of the appointments are a combination of walk-ups or other types of appointments. But new appointments, it's about 1,200 that open up. We've seen much less demand on the system as it relates to appointments over the last week or so than we did a few weeks ago. So the changes we made are working, and there are more appointments now that are available. Also want to just announce, you probably heard, as we all did, the governor announced that hair salons and barbershops and personal care can begin to move outside if a business is able to. Cal OSHA has put together some new standards, and employees, workers, these businesses now can work with these new guidelines that if you are able to do a haircut, if you're able to provide a personal service outside and you feel you can do it safely and meet the standards that are put in by the state, the city is allowing that type of work. So the city understands that there can be conversions happening in parking lots, maybe in some cases even in some parklets, but we know that these activities need to be performed outdoors, and that they also are complex in some cases because of the sanitation that is required. And so we are here to help any businesses that want to transition into this as well. We know there's going to be a need for support. And we also know there are some types of activities that are personal care that are not allowed or aren't able to go outside. These include electrology, tattooing, and others. But as it relates to barbershops and that type of personal care and salons, those are able to move outside. If you have any questions about how you as a business can do that, you can contact our biz line, which is 570-4BIZ, or email the number 4BIZ@LongBeach.gov, and we'll work with you to move your business outside if you would like to do so. Also, just want to add that we are launching today our Youth and Young Adult Ambassador Program. This is a health ambassador program that the City Council has approved. This brings the ability for us to bring younger people from across the city, young adults, who then come out, are health ambassadors. They educate the public. They work with the health department. They go into communities that might be underserved while providing important jobs for those young people. And so it both provides a job for young people, it trains them in health, that they get some on-the-ground training, and then they go out and assist us with this COVID-19 pandemic. And so if you have more information, if you want more information about the Youth Ambassador Program for youth and young adults, you can call also you can call 570-3700, and that is actually our workforce network phone number, and that's 570-3700, and that's our workforce development network, and they have more information, or it's available at the LongBeach.gov website. Before I wrap up and pass it over to Kelly Colopy, I want to also invite for any Khmer speaking residents, we're having our Cambodian Conversation Town Hall tonight on COVID-19. It will all be in Khmer. The virtual event will take place this evening at 5:30 p.m. and it'll all be live streamed on the city's Facebook page. And we know the Cambodian community has been promoting this event pretty heavily, and we look forward to be able to provide information in Khmer directly for these residents that really rely on the translation. So thank you for that. And I'm going to turn this over to Kelly Colopy from the Health Department.
Thank you, Mayor. Good afternoon, everybody. So today I'm going to talk about some of the indicators of COVID-19. You hear me talk about these about every other week. And these are the indicators that we look at to really determine how we're doing as a city. So first of all, I want to share with you about, while we're looking at our positivity rate. We keep hearing about that. I want people to get clear on what is a positivity rate. So the number that we give out is a 7-day average rate for the positivity. And so last Tuesday, that rate was on July 14th, that rate was up as 15.1, which was near the highest positivity rate that we've had within the city. And then on Monday, it dropped to 14.1, and then as of yesterday, it was 13.5. But that is a 7-day positivity rate. We do not report the positivity rate of a day before because we don't have all the data entered, and we want to make sure that our data are complete before we report them. So we work on the average, and we count back a few days to ensure that we have the full data entered before we report it. So this is a step in the right direction, but we really need to get below 8%, as that's really the state indicator that we focus on. So we do have a lot more work to do. So we do ask that you continue to do your part and to help slow the virus. Recent studies have found that the efficacy of masks, distancing, and hand washing is slowing exposures and outbreaks. One study found that if 90% of the population adopts the hand washing, distancing, and masks, the community could avoid a large COVID-19 outbreak. These practices do work. So basically 90% of everybody in our city, if we could just get into that space and everybody understand their importance, we could slow this trend, we could turn the curve, and we could start to begin to return back to the world, to the life that people want to be living. But it takes all of us to be able to do that. So I call on each of you to take on these practices. We get a lot of questions. I'm going to move to hospitalizations. So we get a lot of questions about hospitalizations, and we report 2 different metrics. So the first thing is each day we report the number of people hospitalized that are residents of Long Beach. So the 106 number that you saw today means 106 people from the city of Long Beach are in the hospital. That does not include any of the, they could be in our Long Beach hospitals, they could be in a regional hospital, they could be in another state's hospital. It just means that that people from Long Beach are hospitalized. So these numbers are reported every day, but what we find sometimes is that they change. So we might report 106 today, but when you go back in a few days and you look at that number, it changes. And the reason for that is because we go in and we start tracking down the data from hospitals that are out of state or out of our, out of Long Beach, and it takes us some time. And then we also have to track on the new admissions, discharge notes, whether on the ICU, and other information like that. So the numbers change along the way, and we want to make sure that you have the most consistent information possible. So there is a graphic, the active hospitalizations for the last 60 days, and what that shows you in the light blue is the day that it's reported. So if you look at all those dates, you'll see in the light blue that is the day, the number that was reported. What you see after that is the dark, or on top of that is the dark blue. The dark blue is what we learn and we go back and we fill back in. So what you might find out is that on one day we'll say there's 100 hospitalizations. The number will show 100. However, 2 days later you go in and it shows that it's 101 or 102. So we want you to make sure that you understand what you're looking at in that graphic. And every day we give you what we know at that time, and we want to make sure you have that, as well as the information that we update along the way. Then what we see is, or what we are seeing, and what the mayor mentioned, is we're seeing a lot more of our community hospitalizations. So that means that those are being hospitalized from our community and community spread. So when we look at our entire population of people who've been hospitalized from the beginning, 57% of those folks were hospitalized from the community. When you look at just June, 72% of people that were hospitalized in June came from community and not from long-term care facilities. So we are seeing a big increase in that space. So the other number that we also look at is our hospital capacity. So that's something that, that we report on fairly regularly here. And what that means is our ability for our local hospitals to care for people who need critical care. So hospital capacity is not just focused on COVID-19, but on all the beds who are available to be admitted to the hospital. We look at St. Mary's, we look at Memorial Hospital, we look at College Hospital, we also look at Lakewood and Los Alamitos. So all those hospitals are considered sort of our network of hospitals serving the city of Long Beach. And that's the capacity that we look at. So we pay attention to that. So what you get in those hospitalization numbers are not just people who are from Long Beach, but what you're getting is all the people, all the beds, all the utilization coming from anywhere to those hospitals moving forward. So people need to understand the difference. So when we talk about what our hospital capacity, it's really focused on our ability to care for others. It also incorporates medical staffing and equipment. So you might have a whole lot of beds available in a hospital, but if you don't have staff to be able to monitor them, then they're not actually accessible. So we pay attention to both of those as well as our ventilators. And what we have been seeing is that we have been seeing a little bit of pressure and hearing about some pressure on our hospitals. At this time, we still have capacity to be able to care for the people in Long Beach and our surrounding jurisdictions. So with that, I'm going to turn it back over to the mayor to questions.
We're going to go ahead and start from some questions from the media. The first questions that we're going to have here is from Haley from the Press Telegram. Haley, go ahead.
Hi, I have two questions. So first, can you just provide a number for the most recent hospital capacity that you know of in the area? And then number two, do you have a sense of how much the testing capacity will increase because of the new requirements that all healthcare providers need to provide tests?
Sorry, I heard the first one and then I was so the first answer is we have approximately 60% of our hospital capacity is available. Sorry, it's being used.
Okay. And then the second question was about if there is an estimate of how much the testing capacity will increase now that all healthcare providers are required to provide testing.
We don't know that as of yet. So it will take some time for the providers to be able to offer those tests, and it requires that they have the contracts with the laboratories and the ability to process the tests as well as the materials. So I don't know exactly how much that will be, but right now we hear from folks who make appointments with the city is that they went to their provider and their provider said just go through the drive-thru. And what we want to be able to do is that those providers and clinics and others are providing that on site, and that they're working with their labs, which are all private labs, that those labs would be able to process those samples and be able to get the results back. The other issue that's very interesting around testing, when people go through our drive-thrus and the results come back, it goes directly to them. It doesn't go to their doctor. So it's not actually in their medical record or in their chart. And what we want to make sure is that as we are looking at COVID as well as we would for flu or anything else, is that becomes part of their, that's part of their medical background, and that their doctors are able to watch for that and to be able to care for them. And so we want to make sure that it's actually there's a full connection.
Thank you very much. The next question will be from Valerie from the Post. Go ahead, Valerie.
Hey there. Can you guys hear me?
Yeah.
Yes, we can, Valerie.
Okay, cool. So for the last week, we've been asking for the details on businesses cited for violating the health orders. That information was previously released to us by the PD when it was under their jurisdiction, but now the city isn't releasing it to us without a PRA process. Why is that? And then in addition, with the rise in cases, when is the task force going to stop the education first approach and start citing more businesses who aren't following the rules after months of the stay home order?
So just to answer the first part of the question, so I think you said that you're looking for the list of businesses that have violated the health order, and then in the past, the police department had that list and would put the list out, but now it might be in the health department and you're not able to get the list. Was that the question, the first part?
Yes, we're being required to do a PRA process, but it's just a list of citations that the city has issued.
Let me just say, I don't know what the official standard is. If we can put that information out, I think we should put it out. If we were putting it out, I don't think there should be a reason why we don't put it out. And I'm not sure if there's maybe if there's health privacy information or not. I'm not really sure.
Well, so the issue around violating the order. So we have a venue task force who goes out regularly, and so they start with education, usually the first time. But then what we find is you go out and we give them an administrative citation. So administrative citation does not fall under is not a police citation; it's an administrative citation. So they'll get they'll get a couple of visits of administrative citations before the police department gets involved. So it's not a police function until, I want to say, the fourth visit, in which case then it becomes, it's a criminal citation, which is, I believe it's a misdemeanor. So there is a process that we move through. We have been moving through. We have closed a couple of restaurants based on the violation of the health order, and those have been posted under the health department closures.
All right, Kelly, well, we have some questions here from some of our social media on Facebook for sure. A lot of questions today about long-term care facilities. And some of the questions relate to what support is being offered to long-term care facilities to provide routine testing for all staff, and why are there so many cases of deaths and cases of COVID in the long-term care facilities?
Yeah, so the long-term care facilities, actually what we're seeing is that there's a lot of stabilization right now in our long-term care facilities. So when you start to look at the hospitalizations, the number of cases and all of those numbers are actually have stabilized, and in some are going down. We have a number of facilities for which we had early outbreaks who haven't had a case in over 14 days, which is just, we really see that as a success. Generally, when you have cases in long-term care facilities, they are people who are out in the community, who are the workers. And what we do, what we're doing there is they are screened every day before they go in, and there are processes coming together for some regular testing. That also, we do have the mobile health clinic, and so when there are outbreaks in our long-term care facilities, the mobile testing clinic will go to that site and work to test everybody who is in there. So we are doing much more testing. But we're also working with the long-term care facilities so that they can access their own testing capacity through their labs and contracts through insurance companies.
Another question about long-term care facilities is, do we have enough staff? Do those facilities specifically have enough staff to do what they need to do to maintain those patient care ratios? And if not, are we able to support them from the health department?
So generally, they do have enough staff. We've had, and I won't be able to I actually don't remember which of the facilities that it was. We had, at one point, we had a facility who did have sort of a staff crisis, and we worked with the state and our local region. We were able to bring in the supports that they needed to be able to continue operation and to do the work they're doing. Generally, the long-term care facilities are doing a great job with their staffing.
Great. Thank you very much, Kelly. Another question from Valerie from the Post. Go ahead, Valerie.
Hey, so I'm still a little bit unclear. I understand that you guys do administrative citations, but I'm just wondering, why aren't you releasing that list when it's public record and also a matter of public health?
I mean, I have to go back and look what that process is. I'm not aware that that those haven't been posted or what the issues are, so I don't have an answer for you.
All right.
Okay, thanks.
Thank you, Valerie. All right, Mayor, there's a question here about, and this might be something that both you and Kelly can comment to, but this is, are we trying to separate from the county and LA City since our numbers are better and we have our own health department? We've had this episode and going back and forth in the months previous. Is there any more discussion on that?
We actually work very closely with the county and LA City. So while the rates per 100,000 are not as high as what you see in LA City and LA County, our case numbers, so we focus on the state stability indicators, so just like they do. And we have two stability indicators that do not match, would not pull us off the list to be able to separate even if we wanted to. So right now you have to, you're supposed to have under 100 cases per 100,000 people. And I don't have this exactly right, but I think we're at about 380. So we are very high on that rate. You have to be under 8% in your positivity rate. We're still at 14.1. So while our numbers per population are a little bit lower, we still have a lot of work to do as our city, and it works better as a coordinated effort because there's just so much mobility across. So there are many people in Long Beach who work in LA City or LA County. There are many there that work here, and so we all have to be in it together to really strengthen our response and ensure that we're supporting the messaging and the work together.
And let me just finally also add, because this question keeps coming up. I think it's just kind of once and for all, so that people are very clear that even if Long Beach was taken only on its own numbers, having nothing to do, this has nothing to do with LA or LA County. on our own numbers, we do not meet any of the state requirements necessary, or the major state requirements necessary to somehow move faster or reopen things. So we do not meet that. And so whether or not we're with the county or not, really, it doesn't matter, because while our numbers might be slightly better than the counties in some areas, they don't come close to meeting the statewide benchmarks for any additional type of reopening or anything else. And at this point, what we're really focused on is just keeping the community safe and getting our numbers better. And the whole state is actually in not a great place right now. So I think that's just the general consensus from the state and the governor.
Mayor, while I have you up there, there's been a lot of great movement on behalf of the city and helping with the parklets and helping with the open streets and things that we're working towards. And one of the questions is about business license fees. And this has come up multiple times in our conversation. For those businesses that have been forced to shut down, is there any further conversation about how we might support those businesses or reimburse those fees for those businesses that haven't been able to operate?
I mean, I think I've heard that a couple of times. I'm under the understanding that that's already in the works. And so it's my understanding that the city is either extending or reimbursing or giving back, whatever the affected business is, it relates to COVID. We are doing that. So we'll have to check in with the economic development team, but that is happening. So people shouldn't have to pay a business license if their business is closed. And so we're figuring that out, and we'll take care of that absolutely.
Great. Thank you, Mayor. We got two more questions for Kelly, and that will wrap it up for our questions today. And Kelly, this is also about face shields, and obviously the restaurants with the parklets, and people are going and trying to still eat at restaurants. A lot of people are seeing the servers wear masks, but it's kind of hit and miss and sporadic as whether or not they're wearing face shields. Are face shields recovered or required, I should say, in addition to masks for those that are servers, or is it just the masks?
No, face shields are required. So the way that we look at it is the face covering protects other people from you, right? So if I go and I sit down at a restaurant and I can possibly eat with my face covering on the whole time, then maybe the servers wouldn't have to wear the face shield. But when you eat, everybody around you, they take off their face covering and they don't have it on for the rest of the time that they're there. So what the face shield does is, I sort of joke around that it's like a personal plexiglass. So the face shield then protects the person who is the server from what is sort of an unprotected set of interaction that you would otherwise not have if you had face masks on.
Great. And this will be the last question from our social media followers out there. Massage therapy. And this is obviously, we've talked about personal services, and it's been a challenge for a lot of these businesses. Is massage therapy included in personal services that could be allowed to work outside if they develop those contingency plans?
Yes, it is included in the personal services.
Great. Thank you. That does it for our questions from Facebook and our social media and our media outlets. Thank you very much. Mayor, we'll turn it back to you. Actually, we're going to do our Spanish interpretation, so we'll go ahead and have our Spanish done.
Muy buenas tardes. Hoy es nuestra sesión informativa para el jueves 23 de julio del 2020. Los comunicados son cada lunes y jueves a las 3 de la tarde en vivo. Empecemos con datos generales. A la fecha, 7,225 residentes han dado positivo por COVID-19. Este es un aumento de 703 casos desde nuestra última conferencia de prensa el lunes pasado. Aproximadamente 5,480 personas se han recuperado y ayer no tuvimos nuevas muertes relacionadas con el virus. Estamos contentos con eso, pero queremos recordar a los residentes y a cualquier persona en nuestro país que pueda ver esto, todos debemos continuar usando máscaras y distanciamiento físico. Lamentablemente, desde que comenzó esta pandemia, hemos perdido 161 residentes de Long Beach debido a COVID-19. De esas muertes, 118 se han asociado con centros de atención a largo plazo. La primera imagen que fue enseñada muestra Long Beach con la línea azul clara. Nuestras muertes por 100,000 se mantienen abajo del porcentaje del condado de Los Ángeles, pero arriba del estatal. La segunda imagen que fue mostrada muestra la mediana de edad de los casos de COVID-19 recién diagnosticados en Long Beach es ahora de 33 años de edad. Si se recuerda, cuando empezó la pandemia, era 52 años de edad. Los jóvenes se están infectando muchos sin síntomas y luego se lo están transmitiendo a los padres o abuelos. El grupo de edad de 20 a 29 años cargan el mayor porcentaje a casi el 23%. Imagen número 3 mostró que casi el 40% de nuestras hospitalizaciones son de personas menores de 50 años. Pruebas. La ciudad ha omitido una orden de salud que dará acceso a las pruebas de COVID-19 en todas las instalaciones de atención médica. Esto incluye clínicas. A partir del viernes 31 de julio, todas las instalaciones de atención médica en Long Beach deben ofrecer pruebas a todas las personas sintomáticas, así como las personas asintomáticas que pueden haber estado expuestos o cumplen con otros criterios. Las pruebas de diagnóstico son esenciales y ayudan a identificar a las personas que son infecciosas y a prevenir enfermedades graves y hasta la muerte. Se requieren citas para las pruebas y se pueden hacer en línea llamando al 562-570-4636. Otra vez, esas pruebas se pueden hacer en línea o llamando al 562-570-4636. Las citas estarán disponibles con hasta 3 días de anticipación. Ahorita la ciudad está ofreciendo 1,400 pruebas diariamente y 1,200 de esas pruebas son con citas. Las demás son aquellas personas que están llegando y necesitan una prueba sin cita. Se ofrecen pruebas gratuitas para todos los residentes de Long Beach y las ciudades cercanas. Mencioné el lunes que esas ciudades incluyen Signal Hill, Lakewood, Compton y Paramount. Ahora vamos a hablar sobre los salones de belleza. Hace unos días el gobernador anunció nuevas pautas para salones de belleza al aire libre, peluquerías y salones de uñas. Además de las pautas permanentes, los establecimientos que operan al aire libre deben cumplir con lo siguiente. Normas de Cal OSHA para la prevención de enfermedades por calor para esos trabajadores que van a estar trabajando al aire libre. Recomendar a los empleados que usen bloqueador solar y tomar en cuenta que mover el trabajo al aire libre crea riesgos adicionales. El uso de cables de extensión eléctricos pueden aumentar la probabilidad de riesgos eléctricos, incluyendo incendios y electrocución. Asegúrese de que no haya riesgo de tropiezos y establezca una área de recepción al aire libre donde los clientes pueden registrarse mientras sigan las pautas de distanciamiento físico. Esto también puede incluir en lotes de estacionamiento. Los servicios que no se pueden realizar de manera segura al aire libre o que requieren que un cliente tenga que ingresar al salón no están permitidos hasta que los salones puedan reanudar las operaciones al interior. Cualquier sombra exterior o área de trabajo exterior debe tener la misma ventilación y flujo de aire que el exterior. Se recuerda que los tatuajes, los maquillajes y perforaciones permanentes no se pueden hacer en el exterior. Son procedimientos invasivos que requieren un ambiente higiénico controlado. La ciudad también va a empezar un programa que se llama el Health Ambassadors Program, que es un programa para gente joven y adolescentes, que va a ofrecer trabajo, que va a también asistir a la comunidad. Si quieren más información sobre el programa, pueden llamar área 562-570-3700. Un recordatorio, hoy a las 5:30 de la tarde se transmitirá en vivo en la página Facebook de la ciudad una junta con la comunidad camboyana sobre COVID-19 y la respuesta de la ciudad. La directora del Departamento de Salud, Kelly Colopi, dio nueva información sobre la tasa de positividad. Nuestro número de casos positivos sigue aumentando en Long Beach, pero me complace informar que nuestra tasa de positividad está disminuyendo constantemente. Como recordatorio, nuestra tasa de positividad es el porcentaje de individuos durante un periodo de 7 días que se analiza para detectar COVID-19 que son positivos. Este porcentaje se ve afectado tanto por la cantidad de personas en la comunidad que tienen COVID-19 como por la cantidad de personas que se están haciendo la prueba. El martes pasado, 14 de julio, nuestra tasa fue casi la más alta en un porcentaje del 15.1%. El lunes pasado, el lunes 20, fue de 14.1% y hasta ayer fue de 13.5%. Aunque lento, ese es un paso en la dirección correcta. Para cumplir con los criterios de reapertura del Estado, debemos estar por al menos al 8%. Quédese en casa lo más que pueda, cubra su rostro cuando salga y practique distanciamiento físico y lavándose las manos con frecuencia. Un recordatorio, por favor, fiestas de cumpleaños, reuniones con amigos y familias, por favor no lo haga. Hospitalizaciones. Recientemente hemos recibido más y más preguntas sobre las hospitalizaciones de COVID-19. ¿Cómo estamos rastreando los datos relacionados y cómo compartimos este número diariamente? Vamos a darle un poquito de detalles sobre esto. Nuestro número de hospitalización incluye a los residentes de Long Beach que están hospitalizados con el virus. Las hospitalizaciones de pacientes con el virus se informan todos los días, pero con el tiempo los números cambian a medida que recopilemos información más precisa sobre aquellos que ingresan en Long Beach y también los residentes de Long Beach que están recibiendo atención en los otros hospitales. Por ejemplo, si hay una persona que está recibiendo asistencia médica en un hospital en el condado de San Diego, esa información quizás pueda tardar unos días para llegar con nosotros. Estos datos tienen menos que ver con el impacto en nuestros hospitales y más con la gravedad de la enfermedad y el impacto en nuestros residentes. Hay muchos factores que complican la notificación de este número: las fechas de ingreso y alta de las personas, notas sobre si están en una unidad intensiva y otra información. Otra vez, queremos recordarles que además tenemos que tomar en cuenta que no todos los pacientes de Long Beach que tienen COVID-19 están hospitalizados en esta ciudad. Algunos están en el condado de Los Ángeles o en otros estados. Y mientras que el Departamento de Salud se comunica con esos hospitales, tenemos que solicitar los registros y se puede tardar o tener un retraso en esa información. Si, por ejemplo, se dio información que teníamos 100 casos el lunes, quizás tenemos que regresar y cambiar esos datos a 101 o 102, como va llegando esa información. Actualmente hay 106 residentes de Long Beach hospitalizados por COVID-19. Todavía estamos viendo un aumento en las hospitalizaciones comunitarias. Estos son aquellos que están hospitalizados por la propagación comunitaria de COVID-19 y no están asociados con un centro de atención a largo plazo como un hogar de personas mayores. El porcentaje general de hospitalización atribuido a casos comunitarios es el 57% y el porcentaje general de hospitalizaciones a casos comunitarios desde solo el mes de junio es 72%. Entonces, otra vez recordamos que es muy importante que la gente se mantenga en casa lo más posible, use sus mascarillas cuando están fuera. Además, seguimos viendo a adultos más jóvenes en el hospital, no solo aquellos que consideramos como personas mayores. Casi el 40% de nuestras hospitalizaciones han sido personas menores de 50 años. Ahora vamos a dar información sobre la capacidad hospitalaria. También hemos estado recibiendo preguntas sobre eso y cómo es que estamos reportando esos números. La capacidad hospitalaria se refiere a la capacidad de la ciudad para atender a personas que necesitan atención médica crítica. La capacidad hospitalaria no se centra solo en aquellos que tienen COVID-19, sino en cualquiera que necesite ser ingresado en el hospital. Eso incluye una emergencia, una operación que se ocupe, incluye a los hospitalizados, no solo a los residentes locales. Entonces puede incluir personas fuera de la ciudad que necesitan los servicios de nuestros hospitales. Los datos de camillas se centran más en los impactos en los hospitales y en la capacidad de nuestra región para atender a aquellos cuya enfermedad se agrava. Este es el indicador que preocupa cuando hablamos de los sistemas de atención médica que se ven agobiados, no solo por COVID-19, sino por los problemas que requieren atención hospitalaria. Entonces, hablamos de todos los servicios que se daban antes del virus, operaciones, personas que quizás van a dar a luz. Entonces, todos esos servicios todavía siguen. No solo tiene que ver con la cantidad de camas disponibles en los hospitales locales, sino también con el personal médico y el equipo necesario para atender a aquellos que requieren servicios. Entonces, la importancia no es nomás las camas que estén disponibles, sino también las enfermeras, los doctores y también el equipo que es necesario para seguir dándole servicio a esas personas. Por lo tanto, es posible que podamos ver un aumento en el número de residentes que estén en el hospital por COVID-19 mientras nuestra capacidad hospitalaria se mantiene estable. Ahorita acabo de escuchar a la directora decir que es un 60% en lo que estamos ahorita llenos en los hospitales. Somos afortunados de que nuestra capacidad en los hospitales continúe siendo estable y adecuada. Entonces, recordamos a todos que por favor tengan cuidado, manténganse en sus casas lo más posible y no estén en reuniones con familias o amigos. Eso es todo por hoy. Gracias por acompañarnos. That is all for today. Thank you for joining us.